One of the things that we're really focused on is just growing our relationships with our education partners. So as we train new staff to be able to do new skills, some of our partners like Bolivar Technical College has been so important to us. The internships that we're able to provide, the programs where we provide clinical rotations for them, they've been great to work with. We're getting more and more nurses from Bolivar Technical College than we've ever gotten before.
BTC and CMH have partnered in a variety of different ways to give nursing students and nurses the best opportunity. First, we begin with recruitment of local community individuals who are interested in serving in healthcare. We provide opportunity through clinical, both through our apprenticeship program, in which students can actually earn money while they're doing their clinical rotations, in addition to having a regular clinical site at CMH where they can continue to learn and grow while they're working in the same environment, as opposed to going to a lot of different locations and starting all over.
Another way that we collaborate with BTC is through our academic nurse preceptor program. This program is actually funded by a grant that BTC received. And what this program actually does is help both our nursing students, CMH, and BTC. So for BTC, this provides an additional way for them to have clinical instructors to help supplement training of our nursing students. And then on the CMH side, it gives our nurses at the bedside an opportunity to teach and do something a little bit different to support nursing students in their training. And then for the student, they actually get a really, really unique experience. Instead of the traditional model where you have 8 nursing students with 1 clinical instructor and they're in this cohort, the student nurse actually gets 1 clinical instructor who is that academic nurse preceptor, and they receive one-on-one attention from a preceptor to help them with their training and to meet their clinical objectives.
Our nurse preceptors aid in CMH retention because it's giving bedside nurses an opportunity to work as nurse educators. So they're getting to grow the next generation of nurses. And so that's contributing in a meaningful way, not just to the wonderful patient care that they're doing at the hospital, in the clinic, in the surgery center, wherever it may be. They're also dedicating their time to training nursing students that are going to be their co-workers, maybe in the next, even few months when they start working at CMH. The additional benefit comes after graduation. It's almost like starting their orientation before they're ever even hired. So they're immersed into the culture, they know what the expectations are, they can feel comfortable in reaching out to their assigned preceptors because they've been working with them all along. And this makes the transition to practice so much easier, which is one of the biggest obstacles that nursing graduates face. And so this pathway, like I said, from the beginning all the way through being employed as a nurse, creates that system and support that we're going to continue to grow and build and offer to the residents in our community.
I would actually say our partnership with BTC is essential to the growth and sustainability of nursing at CMH. That is how important it is at this time.
New nurses are joining CMH because they see we invest in them, in their education, and then when they get here and they see that we pay competitively and we care about them so much, they stay here. And we're seeing that that's a trend that's just gotten better over the last couple of years, that our retention is improving, and our ability to recruit nurses and frontline care workers has really gotten better.